Hey everybody, Dr. Benjamin Benulis here. Welcome back to my channel. Wanted to share with you some very exciting news today. A study got published this week on medically supervised water fasting safety, and this is huge. Medically supervised water fasting has been around for a long time. Water fasting itself is probably the oldest healing modality. Everybody in the Bible did it. And so it's one of those things, it's extremely effective at treating a large number of chronic diseases, but it is frowned upon for the most part, or unknown in most of the mainstream medical community. And when you don't have large-scale safety studies, it's easy to poo-poo on it and basically say it's dangerous. Well, that's all changed. Now we have a large-scale safety study. This was published in a journal called BMC, Alternative Medicine, and it essentially chronicles 763 cases of medically supervised water fasting that happened between 2006 and 2011, and looks at adverse events where people had anything from a runny nose to had to go to the hospital. And so it essentially breaks fasters down into short, medium, long, and extended fasts. And then it breaks the adverse events down from a rating of 1 to 5, 1 being like very minor, 5 being the most severe, i.e. death. There were no level 5 adverse events. There was one level 4 where someone had to go to the hospital. They ended up being fine. But for the most part, most people had 1 and 2 level adverse events. And so you can look at the study. I'll put a link below. It's really cool because the actual journal article is free for download, so you can check that out. And it effectively shows that fasting, when done properly and properly supervised, because you're not saying that anybody should just do a water fast on their own unsupervised. You definitely want to be supervised. You want to go to a facility like True North Health Center in Santa Rosa, California, and do it there under the supervision of doctors who know what they're doing. But we show that in those cases, fasting is extremely safe. So we know that it's been effective for a while, and we have research to show that it's effective, but it's hard to get this research published when you don't have the data to show that it's safe. And now we have the data to show beyond a shadow of a doubt. 763 consecutive patients shows that it is extremely safe. It's much safer than many medical procedures today, which, as I've talked about on this channel, kill many patients. 100,000 people die every year from medical errors, meaning drugs taken in the manner prescribed and surgeries that failed. And so we have nobody dying in 5 years. Well, actually, we have nobody dying in 30 plus years of 15,000 patients at True North. So very, very safe and extremely, extremely effective. So if you have any kind of chronic disease, hypertension, diabetes, autoimmune, arthritis, the list goes on. Fasting is a great way to heal from that. So I'll put a link down below. You definitely want to check out the study. It's, like I said, it's you can get the full journal article for free, which is rare these days. Most of the time you have to pay. And so it's not just an abstract. You can read the whole study, and it breaks down very clearly that fasting is extremely safe. So if you're interested to learn more about medically supervised water-only fasting, definitely check out the True North website. That's healthpromoting.com. You can also check out a list of doctors who are certified to supervise fasts on the International Association of Hygienic Physicians. That's IAHP.net. I'll put a link down for that below. Check it out, spread the news, share the link. This is big. This means that much more research on fasting's efficacy for these chronic diseases is going to come out now that we've proven that it's safe. I'm very excited. You guys should be too. I'll catch you guys next video.